This is the Geriatric Summative lecture on aging, mostly review from what we've talked about throughout the semester. The learning outcomes for this are to identify physical changes relevant to the geriatric population, describe the psychosocial development that occurs in the geriatric population. 3. Apply learned theories pertinent to the geriatric population utilizing cinema. 4. In clinical, you would recognize age-appropriate physiological and psychosocial changes in the geriatric population utilizing evidence-based tools. Those are our assessments. 5. Identify common conditions that affect cognition in the geriatric population. 6. Recognize signs and symptoms indicative of elder abuse. 7. Identify the interventions to support health promotion and independence in the geriatric population. The next slide is an interview with a nurse who does geriatric care, and so I recommend that you watch that video. So we want to talk about how immunity changes in the aging system and if there's any different signs and symptoms of infection as other age groups. So in the elderly, the immune system is changing. It is slower to respond, which increases the elderly's susceptibility to diseases, whether they're communicable or not. So they do have an increased susceptibility to the flu or even say to a C. diff infection. They heal more slowly because they don't produce as many immune cells as they have in the past. And remember, their signs and symptoms of infection can be a little bit different than in a younger adult or child. There's less of a fever, sometimes fewer other signs and symptoms, and you really need to look for that change in personality, confusion, irritability, delirium that we talked about in class. The next slide is alteration in mobility. What are the effects of aging related to mobility? And what nursing interventions or education can a nurse provide a client with impaired mobility? The effects of aging, we have a loss of calcium in the bones, decreased bone density, decreased muscle mass, and loss of joint flexibility. So all of those can result in an increased risk of injury, increased risk of falls, and nursing interventions or education the nurse can provide a client with impaired mobility would be medication administration, doing that properly, providing opportunities for safe exercise, providing group walks or group activities, provide mini teaching seminars on the benefits of being active, reporting problems to the physician. We are always teaching, always assessing medications and their effects, changing positions slowly. If you remember from your clinical experience, getting people in and out of bed, it didn't always go quickly, but that slow change will also help prevent the orthostatic hypotension. Educate to and keep them safe. Educate to keeping them active and limit bed confinement. Ensure proper arthritis and osteoporosis treatments are being carried out. Patients should use assistive devices as they need, canes or walkers, gait belts. Beds should always be in the low position and the call bell should always be readily within reach. Brakes on wheelchairs are locked when the person is getting up or down, in and out of it. And the path should be kept clear. Spills wiped up. Lighting might need to be adjusted because remember they have less vision. And any home environment, or even if you remember, rooms in the long-term care can get very cluttered and have a risk for safety there. Next slide is alteration in nutrition. What are the effects of aging related to nutrition? What assessment tool could you use? What nursing interventions or education could a nurse provide to a client who has an alteration in nutrition? Gum disease or problems with teeth or poorly fitting dentures definitely contribute to alteration in nutrition. A decline in taste, a decline in smell. Remember, those are very related to eating. Or dysphagia, trouble swallowing. Nursing interventions or education that a nurse could provide, making certain that the client has properly fitting and cleaned dentures, scheduling dental checkups as needed if they need assistance with that, providing healthy foods, and maybe tasting different types of foods to see if they like them. Have a mini seminar on proper nutrition, a field trip to the grocery store to point out proper food selections and encourage recipe exchanges between clients. Make certain that clients sit in proper position for eating and report any choking or swallowing problems to the physician to see if there needs to be a referral to the speech-language pathologist. You also have access to the mini nutrition assessment tool in your Moodle shell from the week of Geriatric Summative. So alterations in skin. What alterations occur related to skin and wound healing in the elderly? What assessment tool could you use? What nursing interventions or education would a nurse provide a client with an alteration in skin integrity? So a lot of alterations in skin in the older adult, and you can find these in your textbook in the hygiene chapter, and also looking at the integument. So we definitely know that older adults have thinning, drier skin than younger adults, and that can cause more injury to the integument, that they need to have fewer baths because that can dry out the skin more, making sure that they're using lotion. Their skin does not heal as well when they do have a skin tear or pressure ulcer, so that can be an issue. We know that they are more prone to infection in any wounds that they have. They also have change in circulation and change in mobility, which can result in more pressure, less oxygen to the tissues. And so we see all of those things coming together. We know they have more problems on their feet, with their skin on their feet, calluses, cracks in the skin, and really requires a lot more care than a younger adult. Assessment tool that we could use to predict pressure ulcer would be the Braden scale, and nursing interventions that we could do to provide a client if they have an alteration in skin integrity. Some interventions that the nurse can provide would be frequent assessments, hygiene or assistance with hygiene, and that includes pericare as well, moisturizing, turning and changing in position, using any assistive devices like special mattresses or pads and chairs, assessing nutrition as well, because we know that skin problems and nutrition are closely related, and notifying the care provider if any changes that require treatments need to be made. When we talk about the next slide, alteration and oxygenation, remember that the elderly have decreased flexibility of all their tissues, so that includes their heart and lungs, and so that can affect their oxygenation, their blood flow, their circulation throughout their body. Their breathing is different. They have decreased muscle mass for breathing as well. And even coughing can become more difficult for them because of that. They also have a lower immune response in regard to their cardiopulmonary system too. Their sleeping is different. They have a decreased respiratory drive while they're sleeping. So lots of changes in oxygenation area. And so what are some things that nurses can do with them? We can provide lots of assessing, listening to their lungs. Do they need to know how to cough properly? Do they need oxygen? And remembering if there's a history of COPD, that we're providing low flow oxygen, 1 to 4 liters at the most. That we are teaching them how to breathe deeply. We are elevating the head of the bed. We are encouraging fluids when possible. We are monitoring vital signs as well and promoting health, such as nutrition recommendations, lower salt intake. When we have patients in acute care, we might need to do some extra special care, such as titrating oxygen, such as suctioning to help remove fluids and maintain a patent airway. And learning all those different types of coughs. Sometimes we might need to provide chest PT or physiotherapy, and that is kind of the banging on the chest to break up any secretions. And anytime we can encourage incentive spirometry and ambulation or activity, that is going to help the cardiopulmonary system. The next slide is alteration in urinary elimination. And we're going to move that into part 2 of the Geriatric Summative Aging podcast.